Hello everyone, I am Sachin Haridas Rohne, Assistant Professor, Yashoda Technical Campus, Faculty of Pharmacy, Satara. In this video, I am focusing on antihistamine, specifically H2 antagonist, which act on the H2 receptor. In this video, I have covered the introduction regarding H2 antagonist, then the H2 histamine, the receptor location, then uses of H2 antagonist, then the development, and I have also covered three drugs, that is Symmetry, Famotidine and Ranitidine. Now let's begin with H2 antagonist. Some histamine responses such as the dilation of pupil, dilation of the capillaries, then the acid secretion, then the increase in heart and force of heart contraction are generally mediated through H2 receptor. The classical antihistamine is unable to cover or counteract such responses which is shown by H2 receptor. So there is a need of H2 antagonist which can cover or counteract these responses by blocking the H2 receptor reversibly. So generally this can be useful in duodenal ulcer as it blocking the acid secretion as well as it also counteract the enzyme secretion. Now let's see the location of H2 receptor. It is located in heart, then it is located in muscle, stomach, blood vessel and smooth vessels. Now just check out the therapeutic application of H2 antagonist. It can be helpful in heartburn. It can be helpful in the GERD, that is gastroesophageal reflux disorder. Useful in the erosive esophagitis, that is inflammation related with esophagus. Then gastric as well as duodenal ulcer. The ulcer means there is a erosion of epithelial layer, and Zollinger-Ellison syndrome. So this is the therapeutic application of H2 antagonist. Now let's see the development of H2 antagonist. Here I mentioned the structure of histamine. So first development was taken place by methylation of the 5' position of the imidazole heterocycle of histamine, which produce a 5-methyl histamine, which selective agonist at atrial histamine receptor, that is H2, right? So the further development were taken place by just adding the guanidine analog, which is also called as guanidine analog of histamine. The example, that is N-guanyl histamine, which found to be a weak antagonist activity to the acid secretory action of histamine. No doubt this is the first antagonist, but activity is found to be on a weaker side. So again there is a further development taken place in N-guanyl histamine. The compound name is called as burimamide. The changes were observed, that is the 2 carbon is replaced with 4 carbon, right? And second thing, there is a replacement of strongly basic guanidine group by a neutral that is methyl thiourea group. So compound name is called burimamide. So this compound is found to be first full H2 receptor antagonist. But there is a one problem with this compound, that is this compound having low potency. It means that burimamide having low potency although it having the H2 full antagonist. So again we have just check out the low potency reasons. It was observed that low potency of burimamide is just due to the non-basic electron releasing side chain, which favor a non-pharmacophoric N-pi imidazole tautomer, whereas the basic electron withdrawing side chain in histamine, which predominantly favors the higher affinity for N-tau imidazole tautomer with the receptor. That's why this shows the low potency, right? So it means that we require a compound which having the N-tau tautomer potency or nature, so ultimately it can bind with the receptor. So by considering this point in the aspect, so again there is a certain changes taking place in the burimamide, that is insertion of electronegative thioether, right, in the side chain rather than methyl. So compound name become methiamide, right? So methiamide having the attraction or affinity for N-tau tautomers in the receptor. That's why this methiamide is the we consider to be as a full H2 antagonist having higher potency as well as higher oral viability compared to burimamide. But again there is a problem with methiamide. So unfortunately this methiamide shows a granulocytosis. This is the side effect, right? So because of this side effect, again the further development of methylamide was restricted. So by considering all these parameters, again there is a replacement of the thiourea moiety in methylamide with cyanoimmunofunction group. So in this way, there is a development of Cimetidine. This Cimetidine is the first clinically effective as well as relatively safe member of the therapeutic class. So in this way, the development of H2 antagonist, that is Cimetidine, were taken place. Now let's focus on the first H2 antagonist, that is Cimetidine. So this is the general structure of Cimetidine. The IUPAC nomenclature of Cimetidine is N-cyano N-methyl and 2,5-methyl imidazole 4-il methyl thioethyl guanidine. Right. So now focus on the ADME, that is absorption, distribution, metabolism and excretion of Cimetidine. Cimetidine exhibit relatively good viability, near about 60 to 70%, and of plasma half-life is near about 2 hours. Approximately 30 to 40% of Cimetidine dose is metabolized in the form of S-oxidation and 5-methyl hydroxylation. The parent compound and the metabolite were excreted through renal excretion. Now let's focus on the mechanism of action associated with the Cimetidine. The Cimetidine is a H2 histamine receptor antagonist. It inhibits basal as well as meal-stimulated gastric secretion. Cimetidine acts on H2 receptor in the stomach, then blood vessel, and thus inhibit gastric acid secretion. Now just check out the uses of Cimetidine. Cimetidine can be useful in the treatment of ulcer such as duodenal ulcer and non-malignant ulcer, etc. Now let's see the synthesis of Cimetidine. The starting material in the synthesis of Cimetidine is 4-hydroxymethyl 5-methyl imidazole. So this compound is treated with cysteine, right? That gives an intermediate. So this intermediate, when treated with dimethyl and cyanoamino dithiocarbonate, so that ultimately gives Cimetidine. So in this way, the Cimetidine synthesis will take place. Now let's focus on second drug, that is Famotidine. So this is the general structure of Famotidine. The IUPAC nomenclature is just given below the structure. It is a amide derivative. Now just focus on the ADME characteristics regarding Famotidine. So Famotidine is incompletely absorbed. Viability is found to be near about 37 to 45%. The drug is eliminated by renal near about 60 to 70% and by metabolic route near about 30 to 40%. The famotidine sulfoxide is the only metabolite which is observed or it is found to be in humans. Now just check out the MOA related with famotidine. It is a competitive inhibitor of H2 histamine receptor and having greater potency compared to Cimetidine. It inhibits basal as well as a nocturnal gastric acid secretion, and it is also helpful to avoid or to inhibit the secretion stimulated by the food material. So in this way the mechanism of action of famotidine will take place. Now focus on the uses of famotidine. Famotidine can be useful in the duodenal as well as benign gastric ulcer. It is useful in GERD, that is gastroesophageal reflux disorder, and it can be helpful in a Zollinger-Ellison syndrome as well as in heartburn. Now this is the last drug in the H2 antagonist category, that is ranitidine. So this is the last drug in the H2 antagonist, that is ranitidine. So this is the general structure of ranitidine, and the IUPAC nomenclature is just given below the structure. So it is ethylene diamine derivatives, right? So now just check out the ADME related with ranitidine. So viability of oral dose of ranitidine is about 50% and not significantly affected by presence of food. Some antacid may reduce the ranitidine absorption, right? So it should not be taken within 1 hour before or after the meal. Now just check out the mechanism action related with the mechanism of action that is related with ranitidine is, again, it's a H2 antagonist and it is 5 to 10 times more potent compared to Cimetidine. Now just check out the uses of ranitidine. Ranitidine is given in a combination with a macrolide antibiotic, that is clarithromycin, to treat the patient with active duodenal ulcer which is associated with the H. pylori infection. Right. So this ranitidine can be helpful to eradicate the H. pylori and ultimately reduce the risk of a duodenal ulcer. So in this way, we have just summarized the H2 antagonist, that is, we have covered the introduction, then we have covered the location, uses, and the development of H2 antagonist, and lastly we have covered three drugs, that is the Symmetry, Famotidine, and Ranitidine. So in this way we have covered H2 antagonist in this video. So thank you for watching.